The face is more than just a reflection in the mirror. It's the first thing the world sees and often how society judges us. But for millions around the world, including Nigerians, facial deformities create more than a cosmetic challenge. They bring with them a host of physical, emotional, and social burden. On today's episode of Health Digest, we spotlight facial deformities, their causes, the stigma attached, and access to surgical care. My name is Ogom Ezedimbu, and I welcome you to another episode of Health Digest. We have our guest in the studio, but before we meet him, let's listen to Blessing Ajaka as she shares her experience before and after a surgery.
When I was having the deformity, let me say myself, I was waiting on God because I know definitely one day everything is going to be fine. But the society is very hard. They'll bully you, they'll take advantage of you, they'll stigmatize you. Some will even call you witches. Some will even behave as if I used my money to buy it. After the surgery, I think I got my life back. So I was able to live a free life. Before my surgery, I was even using a scarf to cover my head. At least it gave me some confidence. Small. To be truth, I was okay myself. But societal pressure will kill you. There were sometimes societal pressure even made me to make decision of taking poison. Because I was tired of this stigmatization, the pressure, what happened to your face, this, that, you didn't find solution, you are a witch, you are the one that did it to yourself, you are this, you are that. Even one mistake I did not make was I was still going to school. Assuming I listened to what people said, I stay indoor. Even after the surgery, there's no way I would have started from because I had the surgery at 17. Then I was already in SS1. I was even supposed to be in SS2, but challenges make me to repeat SS1 like 3 times self.
So what was said to the foundation about you?
The foundation has helped my life so much. I was able to complete my secondary school, go for ND, go for HND. No need of covering my head with veil. At least the stigmatization has reduced the body. Let me say body shaming, because that is part of body shaming. Some people even think I bought it. I never bought it. It started when I was 7. 7 years old me did not even know what is waiting for me. It's been 20 years. I'm 27. I've suffered for 2 decades. 1 decade before the surgery, another decade again. When I had discussion with Dr. Bello that my teeth are disturbing me, he said I should come for bone grafting. Maybe he'll be able to help me get a bone because my bone decay. My bone decay. They removed like 13 of my teeth during the surgery. I was not left with 3 teeth here. So in 2020, one teeth had a problem. I have to remove it. Last year, another one again. I have to remove it. But the remaining 1.5 holes, I'm doing filling. I told Dr. Bella I cannot continue like this. I'm tired.
So what's your message to people out there? How they treat people? What do you want to share?
My message to people out there is nobody buy problem with their money. You don't even know problem is waiting for you until you find yourself in it. Some people do as if you even deserve to die, you don't deserve to live. This is me. I was born as every normal child. I was living my life as a child with so much excitement that so much life is waiting for me. I didn't know what this is going to wait for me. If I knew, I would have stopped existing from age 7 now. I would have still go to vanish me. I want people to treat everyone with kindness. Treat everyone as if they deserve to live. Even you yourself, you don't know your next second. You don't know your next minute. Even though all this condition did not come your way, you might die. Even death is enough to teach you a lesson. Those people did not buy the condition with money. Same also, you did not buy death with money. And I think having all these problems is far better than being dead, because one day you might find a solution. No matter how rich you are, how old you are, you don't know what is waiting for you tomorrow. This life is very, very unpredictable.
A very touching story from Blessing there. And to talk more on this is a consultant maxillofacial surgeon who is also the founder of Cleft and Facial Deformity Foundation, Dr. Seidu Bello. Good to have you on the program today.
Hello, viewers. Thanks for being here.
So we are talking about facial deformities. Let's begin by getting to know what this is about.
Thank you very much. I think basically we are talking about diseases of the face, something that deviates from normal. So facial deformity diseases are a group of diseases that affect the face. That when you look at the face, you can say there is something different from normal.
Okay, so what are the causes? How does it happen?
First of all, you know, for the purpose of education and to bring it down to the layman level, we have a number of classes.
Okay.
Yes. First of all, we have what we call facial cleft.
Okay.
That children are born with that. So you can have facial tumors in case you just see any abnormal swelling on the face. Then you can have a noma, in which a childhood disease, which is due to poverty. You just discover that it will just start from the mouth and it will eat up the face. You have something like lockjaw, where you just discover that somebody cannot open the mouth. Sometimes due to trauma or infection, the mouth will just be locked, and it's lockjaw. Person will not be able to open much at all. So that's another category. Now we have trauma. You know, generally, accidents happen every day, and when they occur, it affects different parts of the body. So if accident occur and the bones of the face got broken, and if there's no care and if abnormally, of course, it brings about deformity. You can also have infection of the face. Sometimes infection of the teeth, dental caries or periodontal disease, can lead to, can progress to involve the face and brings about facial swelling, pain, and the rest. And the last class is what I call shape disorder. So you see, this head looks normal, but we have some children that are born with different kinds of shapes. Of course, there are different terms in medical terms, brachiocephaly, plagiocephaly, and all the rest. But you just discover that a child is born and the head, the skull disorders. I call it skull shape disorder. So these are the classes in broad terms. Now, talking about causes, which we always interest all of us. I think sometimes we want to know about causes so that the next question, can we prevent it? Isn't it? It's not in all cases. Some of these diseases are born. For instance, now, something like facial cleft, children are born with it. It's not a disease of any race. As a matter of fact, it is commoner among Caucasians than even in Africans. So that is the finding presently. So facial cleft, children are born with it, and the causes are not really known. You can only talk of possibilities. But things like facial tumor is the same thing as in other parts of the body. And you know, tumor are generally divided into what we call benign. Benign means those that will not kill. So it can grow to grotesque sizes. Sometimes they might be carrying tumor for 15 years, 10, 20 years, but it will not kill the person. So that is basically, but the second swelling is cancer. Cancer is the type that kills. Once there's a cancer of the face, like any other part of the body, if nothing is done, maximum within 2 years, the person will die. So that is cancer. It grows faster and it can kill. It's similar to what we see in breast cancer and cervical cancer, and that is common. But generally, these deformities are the same. So there are different causes of these conditions. I talk about NOMA. NOMA is a disease of poverty, common around the children of less than 5 years that have very low nutrition.
Okay, so it's a nutrition problem.
That one is a nutrition problem.
Okay.
And you discover that it will start from the gum because of low nutrition. What simply happens is that because of the poor nutrition, immunity is low. Then because immunity is low, opportunistic infection of the mouth now supersede and now causes destruction of the mouth, and it can involve the face. Okay. So that is NOMA.
Okay, so you've given us about 7, facial cleft, tumor, NOMA, lockjaw, trauma, infections of the face and teeth, and also shape disorder, shape disorder, like you called it. Yes. Now, from all of these 7, which of them is more common in Nigeria?
You know, what I actually discover about diseases is that if it doesn't come your side, it appears as if it does not exist.
Okay.
It does not exist. I remember that is one thing. But you'll be amazed at the centers where you have these diseases. You'll be amazed what you see. Or maybe during programs when we want to have maybe free surgery programs, you'll be amazed how people, in fact, we go to some places that in some locality, local government, they will still, these cases are not here. But you'll be surprised when you announce a free surgery, you just see these same people will come from hiding. So that is what I just see. So talking about which is common, they are all available. That is just it. Of course, if you are in a classroom, which is more common, we can be talking about. But basically, from the head angle, they are all there. Facial clefts are everywhere. Facial tumors are everywhere. Accidents occur every day. So it doesn't spare any part of the body.
And doesn't have age difference?
You don't have. You see, what we talk about, if you are talking about research findings, we want to say this is common in these ages. That happens. Cleft is in children. NOMA is a disease of children. Okay. But things like trauma, as a matter of fact, general studies will tell you that accidents are common in the 2nd and 3rd decade of life. But that applies to simple reasoning. That is the time that people are active. That is between 20 and 40. That's when they are active, they travel all along. So the trauma is commoner in that age range.
So the infection of the face and teeth, what would that lead to?
The infection of the face, you see, we have dental caries, hole in the tooth. If it's untreated, of course, if it's treated early with filling and the rest, that will be fine. But if nothing is done, it progresses to involve the jaw. Then from there, it spreads to the face and there will be swelling of the face. The same thing, gum disease. If nothing is done, it also progresses to involve the bone and the face. And it can kill. Many people don't know.
Does it chop off the skin?
Usually it doesn't chop off, but it causes a swelling.
Okay.
And what we discover when we open it up, we see pus. A lot of pus that will accumulate on the face.
So how available and affordable in terms of treatment and surgery? Because I understand that some of these things can be corrected through surgeries.
Yes, Nigeria, we are not doing badly. The only thing is that we still have gaps. But, for instance, if you talk about cleft now, we have many cleft centers now,
Okay.
even many of them free, and also with organizations like Smile Train and organizations like Cleft and Facial Deformity, and a number of, we have that. And we also have, the teaching hospitals have maxillofacial centers where some of these facial tumors, facial fractures, infections could be attended to.
All teaching hospitals are selected?
Yes, I selected hospitals. I won't say all,
Okay.
because usually, you know, maxillofacial unit is where these are being done mostly, have been attended to. Also, some plastic department also handle some cases of the face, but commonly maxillofacial surgery is that unit that deals with both teeth and the bone and the face. So that is being done. So basically, these are being done, but the gap is huge. The gap is huge. First of all, we are limited in terms of technology. For instance, if somebody has a facial tumor, for instance, the ultimate, the world over, is not just to remove the tumor. When you remove the tumor, the ultimate goal is to restore this patient to what the patient used to be before any of these diseases. So you want to talk of reconstruction. So reconstruction, yes, we have our limit here, we do a little better. There are ways abroad which will be, of course, will be expensive. That's the usual thing. And these gaps are areas that we have to be thinking about, because we are also human, and a lot of foreign exchanges are being spent by those that have the money. But majority will not have the money. They are just here, you know, and they are just dealing with their stigma. Yes, I talk about skull shape disorder. You might have been seeing some of these children. This ordinarily skull shape disorders is in centers that is well equipped abroad where it's being done. You have combination of maxillofacial and neurosurgeons combining, you understand, to have a long hour operation, but come out with good results. So that one is these are the gaps we have here, which something needs to be done.
When you say something needs to be done, what exactly, what's the role of public health institutions and then government in addressing all of this? You
know, our belief is that government does everything. Government is to attend to this, attend to that. But what I've come to realize is that government cannot do everything. No matter how much we want to see it, because sometimes we even forget that all of us are qualified to be government. You can be a minister, can't I be a minister? So, but we want to push everything to them. That government should do. Government cannot do everything. So that is why there will be private initiatives like public health, as you said, like in Cleft and Facial Deformity Foundation. We are thinking of a focus hospital. That's why we are thinking about Abuja Craniofacial Hospital for the needy. We are looking into this direction. There should be a dedicated hospital where all these diseases that will be so well equipped that can handle all these gaps. Number one, when they can handle all these gaps, people will not have to travel abroad again. In fact, people will have to come from any other place to come and.
So we don't have a designated clinic. Okay,
we don't have.
There's none. For this purpose.
There is none. There is none. There's none. There's no focus hospital. But I said earlier, get me right. We have hospitals in Nigeria, even national.
Where they have departments.
That have department of maxillofacial that can handle all this. But my belief, my sincere belief, is that if we have a focus hospital, that's Abuja Craniofacial Hospital, that will be their sole mandate. So, and it's so well equipped, they will be able to handle all these gaps. Microvascular reconstruction is the height of reconstruction. When you cut somebody's jaw, you should be able to take bone from the leg, a living bone, and attach it to reconstruct this face, and such that you can even put implant immediately, because we call it microvascular reconstruction. you take living bone with blood supply from the leg, and you remove the jaw, then you put up another jaw with living bone from another part. And that will replace the jaw, replace the shape. And also you'll be able to put teeth. And the person, because when the jaw is affected, it destroyed everything. So when you put it back with a living bone, living muscle, you put implant and you put teeth, and the person will be able to eat again. It's very possible. You talk about skull-shaped disorders. Skull-shaped disorders, many of them today, if they have, if you are a child of the rich, they fly you abroad. It's a long, even when it's done anywhere, it's an operation that will be not less than 12 hours operation. Yes, we are making attempt. Many people, many of us have had trainings, but you need the environment, you need equipment, you need all those things. Nigerians are trying.
How is funding like? You know, I know you carry some of these surgeries for free. How is funding like? You know, to get this done? Yeah,
you know, that's another. The question of okay, the free surgery with Cleft and Fisher Deformity Foundation. You see, the reporters have asked me many times about funding. Me, I always tell them, funding is not the biggest problem. It's not as if funding is not. Funding it is. But what I discover is that when you concentrate on problem, you don't move. But belief is possible. So that is what has been happening. It's not as if it's so easy, but we are making effort. And we are making effort. And we are for the past 14 years, we have still been able to weather the storm, do the little we can. Maybe we will have been able to go higher, but at least we are doing something.
Do you have a figure of how many facial deformities you have?
You see, at least
is it reconstructed or repair?
Yes, actually, at least in the past 14 years, we have gone around the country. We've covered like 13 states, about 5 of the 6 geopolitical zones. We've done something like a little above 1,500 major surgeries. Yes. And of course, under Cleft and Facial Deformity Foundation, we also do minor things like attending to dental. And altogether, we've done like 4,500 patients in the past 14 years.
Now, you listen to the story of Blessing Ajaka, where, and she said something that was really touching. And she talked about stigma, how she was treated before the surgery, and even after the surgery still has some of this side talks and all of that. How do you react to stigmatization, especially when it comes to health issues?
Thank you very much. The question of stigmatization is real, and the best professionals can do about stigmatization is to reduce the intensity, is to make the patients better. But aside from that, because it's a real thing, now you are looking at my face, it looks normal. But if there's a big
I'll definitely have a question.
You have to question. So that is how stigma is. In fact, sometimes it's actually an instantaneous reaction. It's not really something is premeditated most times. Like Ajaka's case, I went to Kogi in 2014 and I saw her. And because I had the knowledge, I know something could be done. Helpless, and everybody was just like, and also poor and everything. But within me, I said, yes, something could be done about it. So, but it was already getting late. So we almost ended the program. So luckily, we were able to go back to 2015. And of course, I already had that on my list because during the interview, she said it. She reminded me that I called her. So we prepared her. And we brought down the tumor. Because he said, we are old, what did she know? She was 14 and the swelling started since she was 7. So, and was big. By the time it was a benign tumor. Those that will not kill, but can be long. So we did it, and and she gave a testimony. Now she was fine. At least the tumor came down. Now from that age 14 now is an HND student now in the Polytechnic. So she has survived. Of course, so you still can't do without reconstruction, secondary reconstruction and things like that. But basically, the face is near to normal. So, but there's nothing professionals can do other than to make it better. Like now, we've just had a secondary surgery after almost 15 years. That secondary surgery is also to make her better. We did a bone grafting, and so to improve the shape.
Facial cleft, for example, is something that is born with, right?
Yes.
Okay,
yes.
and there's little or nothing that's...
There's very little.
Little,
yes,
okay.
So we talk about Betty, there's very little.
So the other ones, are they where we can prevent them from?
Yes, yes. For instance, we talk about Noma. Noma is a disease of poverty. It's simply a disease of poverty. So when the child is well fed, you are preventing Noma.
But there are some people who have money and they are still malnourished and they don't eat.
No. When we talk about malnourishment, it gets level. You see, Noma patients, there's nothing like you don't need any soothsayer to tell you that this is poor.
Person is...
No. It's not. If you are talking about somebody that has money but is not eating, know how, you still get enough to be able to get going. Definitely, you still get enough. Even if you have a good environment, educated. I don't think I've seen a Noma in an educated, in a child of educated parent before.
Okay.
That is, everything goes together. Poverty, ignorance, they all go together. So that is that. But facial tumor, you can't prevent facial tumor. Tumor is just abnormal growth. Abnormal growth just occurs in anybody. It occurs anywhere. You can't prevent. The only thing you can prevent is early intervention. A patient came to me, was telling me that there's a big tumor. They saw a big tumor from internet. By the time he brought the tumor, the tumor is like this length, about 4 centimeters. I said, this is what you are calling big tumor. I brought out a bigger tumor. I brought out real tumor. Tumor that will extend from one side of the jaw to the other. I uploaded it to the internet that day because I was so furious when he said he was calling this big tumor. That is it. In the Western world, that's what they call big tumor. Because early intervention. When before people even begin to say, what is this? They go to the hospital. They attend to it. That is it. And if we are able to grow to that level, yes, it's an holistic thing. Health is very comprehensive. You talk about health funding, insurance system. Government cannot do everything. So accessibility, what's the private sector doing? So these are the issues.
Okay, so doctor, before I let you go, I just wanted to maybe give us one last word before you leave the studio.
Yeah, last word, first of all, I want to hammer on Abuja Craniofacial Hospital for the poor.
Okay.
Because we have this concept and we believe that we need support. The hospital is located around Karishi there and requires about 2.6 billion to build the hospital. If this is done, we are going to have first-class hospital that will handle all facial diseases. It's going to be a referral center. It's going to take care of everybody. And more importantly, we are going to have provision for the poor. The poor will be treated free in the hospital. That is the main focus. Another thing is that facial diseases are not really different or special from other health challenges. But what is important is that let's present ourselves to the hospital early. And that will go a long way in reducing the stigma and having better health. Thank you.
Thank you very much. We have been speaking with a consultant maxillofacial surgeon who is also the founder of Cleft and Facial Deformity Foundation, Dr. Seidu Bello. Thank you so much for your contributions on the program.
It's a pleasure being here. It's a pleasure.
And that's our package for today. Thank you so much for being a part. I'm Ogom Easy Dimple. To stay safe.